Part 3 in the Run Chart video series is about the operational definition. So what is the operational definition and why is it important? So the operational definition is a description in quantifiable terms of what to measure and the specific steps needed to measure it consistently and reliably. So the importance of the operational definition is if data is collected differently by different people or differently each time it's collected, it makes it hard to know whether the changes in the data are due to changes tested or from inconsistencies in the data collection. We're now going to discuss operational definition. So our project team needs to define well ahead of time the operational definition of what they are trying to measure. They also need to pilot test, and this can be used through the concept of Plan, Do, Study, Act or PDSA. They need to pilot test that data collection. So all staff in the project that are involved with collecting data need to be very clear on a few things. Firstly, they need to know what they are actually measuring and how the data is to be collected. So with your operational definition, there's a few things you need to think about. First of all, thinking about defining the criteria for judgment. So if you're saying that something is late or harm or a fall or a pressure ulcer or a needle stick injury, what actually constitutes these? What does late mean? What do you mean by late? Also, you need to think about the measurement for improvement. So if you're going to be measuring time, you're going to use a clock, a stopwatch, a wristwatch, or maybe a smartphone. And the degree of precision, are you going to measure it down to the second, to the minute, or to 5 minutes? Also, if you're doing an audit, you need to think about how many, when, and who is going to do the audit. So with your audit, you need to think about objective, scope, and criteria. So what exactly is an operational definition? Well, it's a description in quantifiable terms of what to measure and the specific steps needed to measure it consistently and reliably. So a good operational definition gives communicable meaning to a concept or an idea, is clear and unambiguous. It specifies the measurement method, procedures, and equipment where appropriate, and provides decision-making criteria when necessary, and it enables consistency in data collection. If you'd like to look at these examples of quality indicators and think about, what constitutes a patient fall? What would you define as a patient fall? Or what is a late food tray? What's a food tray when it's on time and when is it late? What is a patient restraint? How would you describe, what was the definition of a clean patient room? So have a look at these indicators and think about their operational definition. If you'd like to see some excellent examples of operational definition, go to their website for the Australian Council on Healthcare Standards, also known as the ACHS. They're one of our accrediting bodies in Australia. They have a clinical indicator program where they have excellent operational definitions that have been agreed by the medical colleges as the data is collected Australia-wide. So they have clinical indicator sets for anaesthesia and perioperative care, day patients, emergency medicine, gastro and endoscopy, gynae, hospital in the home, etc. So why is the operational definition important? Well, it helps us with what we call inter-rater reliability, and that is the degree of agreement amongst our raters. So in other words, our staff collecting data. So the aim is to reduce the subjectivity in our data collection. So it's vital to have very strong inter-rater reliability when you have many people collecting data to ensure that we've got clean and accurate data. So you need to clearly define what you're trying to measure. You need to train and retrain your data collectors, and you need to pilot your data collection tools and methods. And one example of very strong inter-rater reliability is the Australia-wide hand hygiene gold standard auditor training. So pause the video and let's do an exercise on operational definition. So look at the box to the right and choose one of the quality indicators in the box. What I want you to do is define the quality indicator to ensure that it's clear and unambiguous. The second step is to specify the measurement method, procedures and equipment where appropriate to collect the data. And thirdly, I want you to state how you would enable consistency in data collection. For your information, these are the references that have been used to inform this presentation, particularly the 3 books highlighted in the images. This is the end of this section in the Run Chart education session. Please go to the next part of the Run Chart series to learn more and to complete the quiz at the end.